STL. We are marching into health. It's the perfect time to focus on getting those preventative screenings. Today's Ask the Medical Expert is sponsored by Dr. Amy Roberts of Ms. Medicine. And Dr. Roberts is here with us to tell us all about how we can march into good health. Thanks for being here with us today.
Thank you so much for having me. I appreciate it.
Of course. And March is actually Colorectal Cancer Awareness Month. What are some tips to be proactive about preventing and even detecting colorectal cancer?
I think one of the first most important things is taking time. There are so many preventative things out there of scheduling an appointment with your doc to go in and talk to them. In terms of preventative standpoint, it's very important to try and have a healthy diet and eat high fiber or adequate fiber, drink ample water, avoid processed foods because that can feed into wear and tear over time. The other thing, which I know is always a personal, embarrassing conversation to talk about, but take time to go. A lot of people get into the habit of holding things, and it's important to make sure that you're having daily bowel movements or regular bowel movements. What's your normal pattern?
I mean, like you said, it can sometimes be uncomfortable, but it's so important. And that's what doctors are here for, you know, going into and having those uncomfortable conversations because health is at the forefront of what you do. Right?
Yeah. And there are numerous screening options out there. And so going in and speaking with your physician about what's the best screening modality for you, especially with colorectal cancer, there's several different alternatives out there. The colonoscopy, which is still the gold standard, Cologuard, which is actually a home test and can be utilized as a great screening tool nowadays. That's covered well by insurance. And the hidden blood in the stool or fecal occult blood test still has its time and place. So it's just figuring out what's the best option for you.
Awesome. And what are about some of those new and upcoming other cancer screenings that we also need to be paying attention to?
Yeah, and that's why, again, it's so important to go in and talk with your doc at least once a year. The screening recommendations change, it seems like, on an annual basis. But for women, they still recommend going in for your pap smears for different, different time periods. They recommend doing your mammograms routinely. Men, there's still discussion and recommendation for the prostate cancer screenings, and so many other things based on your individual family history, your health history that they would recommend.
It's really just about taking those proactive measures, talking with your doctor, and making sure you're doing what's right for your diet. Really, you support patients' health. Tell us about how you do that, Dr. Roberts.
Yeah, there's so many incredible areas that they're doing research on for early detection of cancer. And it is a really exciting area in healthcare nowadays. I think everyone is motivated if we can have early detection, because that can equate potentially not just treating it, but curing it. There have been some phenomenal breakthroughs in science and that are actually now out and up and running. One that I'm particularly excited about is the Gallery. It's a point-and-care blood test. It can detect over 50 different types of cancer that previously we have not really been able to screen for. Ovarian, pancreatic, just to list a couple, that if, again, you catch, we might actually have a chance of intervening early enough to even cure.
Wow, that is pretty incredible.
It is very exciting.
Well, and speaking of some of those exciting things that is happening in our health world, you have just opened up your new office. Congratulations again. Tell us about how you are serving the greater St. Louis area.
It's been a great experience to be able to have more time to spend with each patient. So when they do come in, we can go over all of the different options out there from preventative screening, and then help people actually be able to set them up and implement the screenings.
And this is through Concierge Medicine. She's just opened up her office in a Lamp and Lantern Village. That practice is now open. So go ahead, you can show them some love if you're interested in working with Dr. Amy Roberts. All that information is going to be right there on your screen. You can visit her at Ms.Medicine.com/Amy-Roberts. Again, located in Lamp and Lantern Village. That address is right there on your screen. And you can also show her some love on social media, on Instagram and on Facebook as well. Again, you can visit them online at Ms.Medicine.com. And of course, we'll make sure you have access to all that information on our website at studiostl.tv. Hey, St. Louis, don't go anywhere. We'll have a lot more of the show in just a couple of minutes.